half of my patients with diabetes do have neuropathy. Some of them suffering from painful neuropathy, and some of them suffers from painless neuropathy. And unfortunately, the only tools available is a fork and a monofilament. And this is standard of care to check patients' feet sensitivity, which seems to me a bit outdated. So the lack of objective neuropathy screening, especially in patients with painless neuropathy, which causing ulcers and eventually feet amputations, caused me to conceive and design DND. DND helps objective neuropathy screening in patients with diabetes or post-chemotherapy or vitamin deficiency or various post-traumatic syndromes. DND objectively discriminates patients with painless and painful neuropathy. In vibration sensitivity, which range from 1, 2, 3, 5 grades. The second mode is a temperature discrimination. The device is able to go from mode 25 degrees, which is a fixed plate, to a variable plate from 15 degrees Celsius to 40 degrees Celsius. And most of the time, inability to discriminate temperature, the very first sign of diabetic neuropathy. As I mentioned, painless neuropathy is more dangerous, and patient is not aware of inability to sense change in temperature or pressure. For example, after the hot summer day, patient may present with foot ulcerations, not feeling the skin was burned or some open ulcer, which eventually may result in a foot amputation. So let me select temperature, sensitivity, and we ask our patient to try to discriminate 2 degrees, temperature 25 and 23 degrees Celsius. Most patients are able to discriminate by their fingers. Would you please touch one plate? Now the next. Do you feel any difference in temperature?
Yes.
Which one is warmer? Which one is cooler?
This one is warmer. This one is colder.
So we have assured the patient understands the procedure, and then we transfer DND to the feet. Would you please tell me, do you feel any difference in temperature in the first plate and in the second plate? Patient not able to. So let me change the setting. Now we have difference in 25 and 21 degrees. And I ask my patient to discriminate temperature in the first plate and the second plate.
Yes.
So patient able to discriminate 4 degrees, but not 2 degrees by her fingers. If patient is not able to discriminate 4 to 6 degrees temperature, we can go to 10 degrees temperature. And as a rule, those patients do have poorly controlled diabetes, poor sensitivity, and require more aggressive medication management.